My name is Dr. Michael Bianco, DO. I have been a physician for over 15 years, and I've been in healthcare for over 25 years now. I am one of the founders and owners of Bianco Primary Care, together with my wife, Dr. Shelley Bianco. We started this practice because we felt there was a need in healthcare for something different to be done. One of the things that we saw as we were learning medicine and taking care of patients in other people's offices was that we were told that the most important thing is to spend time with patients and to listen to them and to get to know them. But in practice, no one was having time to spend with patients, and people weren't making connections. And Dr. Shelley and I would frequently talk about this in the evenings and how we did not want to have a practice that told patients they'd have to come back if they needed to spend more than 2 minutes with us. We want to do something different. We want to give patients the time they need to explain what's going on with them, and we wanted to create that type of environment where both we and our patients felt comfortable and did not feel rushed. As a DO physician, we tend to be a little more on the holistic side of the body has an innate ability to heal itself. And my job is to put patients in a position where they can heal themselves. And so I really strive to dig in on what is the underlying issue, and whether that could be with your nutrition, it could be with exercise, it could be with sleep. And then how do we use those things to try to help the patient help themselves? Sometimes, of course, medications are necessary, and we use them. I'm a traditionally trained physician, and modern medicine has brought us some amazing things. But the first answer is going to be, what are you doing, and how can we maximize and optimize what you're doing so that you don't need to take medications? And if we can do that, I'm happy, patients are happy, and long-term, you're better off. Part of the patient-centered focus at Bianco Primary Care is to try to provide well care. Oftentimes people think of the word health care, and it's been said that it's more like sick care because we wait for people to be ill and then we treat them. We have found that trying to get ahead of illness is the best approach to medical care. And so we really focus on preventative care as well as taking care of people that are ill. And by preventative care, I mean talking about nutrition, talking about sleep, talking about exercise, talking about stress, all of these things that play into our well-being. And we try to find small changes that can be made to improve things. There are numerous studies that talk about physical health and mental health and how closely they're related to healthy lifestyles. And at Bianco Primary Care, we have the time to discuss those things and to try to put them in order, and then to hold our patients accountable. We ask our patients to come back and report on their progress. How is your exercise going? Tell me about your routine and your habits. And we found that as we do that and we help our patients establish those healthy lifestyles and routines, that we get better results. Mostly I want people to feel better because of the things that they're doing to maximize their quality of life, and they can live the longest, happiest, healthiest life that's possible.